Hello, I'm Jeremy Fernandez. Welcome to the program. Now, vaccine rollout took a big step forward this week, with online bookings opening to around 6 million people who are eligible in Phase 1B of the vaccination program. From Monday, people aged over 70, Indigenous Australians 55 and over, more healthcare and frontline workers and people with specific medical conditions will begin to receive their jabs. Roughly 1,000 GP clinics will be able to start vaccinations from Monday, and the government's confident that figure will climb to 4,000 by the end of April.
As we begin Phase 1B, which involves 6 million people, next week we'll see approximately 250,000 vaccines available. So it's a marathon, not a sprint. But as we've seen, we've been heartened by the early response of the public.
Nevertheless, this week's announcement hasn't been without controversy, with many GP clinics saying they were caught off guard by the announcement, and some clinics claiming they haven't even received their allocations of the injections. Joining me now from Townsville in northern Queensland is GP and the Rural Chair of the Royal Australian College of General Practitioners, Dr Michael Clements, and Western Sydney GP, Dr Hani Bittar. Welcome to both of you.
Good morning.
Dr Clements, let me begin with you. How ready are GPs for this rollout, this next phase of the rollout?
Listen, GPs are ready and champing at the bit. Every year we're used to doing this with the flu vaccines. We have our processes and our systems all lined up and ready to go. But we're a little bit caught off guard when the federal government started telling the population to call us to make their appointments when we simply weren't ready.
Why were GPs not ready, given that this has been anticipated for some time now?
Yeah, we've had good communications in terms of a staged planning. So we were told that we should expect the vaccines in the next few days, and we were told how many we should expect. But you'd certainly forgive us if we were going to wait till we had it in our hot little hands before we opened up appointments. So we were aware that they were coming, and we certainly will be opening up appointments both online and in face-to-face. But the problem was that the announcement on Wednesday morning was essentially the federal government saying, call now and you can book your appointment, when none of us were actually opening up for appointments just yet.
And so, Dr Hani Bittar, when those phone lines were opened up, so to speak, were you seeing a lot of interest from people calling in and wanting to get more information, book themselves in?
So an increase in people asking and inquiring about it. As Dr Clements said, we did not receive the vaccines yet. Our practice is allocated start on the week of the 29th, not this coming week. But lots of people have rang, lots of people asked when they are here, and we're trying our best to give the correct information.
What sorts of queries are they reaching you with? I mean, are we seeing some sort of hesitancy in the community continuing because of these ongoing questions overseas around the side effects associated with the AstraZeneca vaccine?
Look, there are two issues in it. One is, yes, the recent with the suspension of the program in some of the European countries did affect some people. But again, in Western Sydney, we have many ethnic community background people who bring in to Australia a lack of trust to government from their background as well. So there are lots of people who are even questioning whether COVID exists or it's a conspiracy. And that's why we tried our best last year to form a group of religious leaders that talk to the doctors and they transmit the correct message to their followers.
There have also been concerns about the pace of this rollout due to circumstances both at home and overseas. How are we going so far, and how do you think how well do you think that's going to ramp up over the next few weeks?
Yeah, listen, I'm very comfortable with the slow pace that it's being rolled out. We've had the benefit of watching and learning from some of the administration processes overseas in Europe and the UK and America. We've got time here. We don't have COVID circulating around our community. We can step this out carefully with good record keeping. We can answer all of the questions to our patients. We're not rushing them through this in some kind of unfashionable way that's going to cause them to ask questions later. So yes, it's going to take a while. I know that the Prime Minister recently stepped back the promise and said first doses by October, November. That's probably still a little bit ambitious, but we're certainly ready, and GPs are champing at the bit to be a part of this.
Dr. Bittar, I know one of the questions you're getting from some of your patients is whether people can opt for the Johnson & Johnson vaccine or the Pfizer vaccine instead. What are you telling them? How are you managing those queries?
Well, I tell them we will keep an eye on any type of vaccine the Australian government and the TGA here allow us to have. At the moment, we have to deal with whatever is available, which is the AstraZeneca vaccine. Pfizer is still given in 3 hospitals here in Sydney, but not in primary healthcare, not in general practice. So we will keep them informed about, especially the Johnson & Johnson, because I think it's a one jab and that's attractive to some people. But at the moment, we have to deal, we are all in one problem together, and we have to deal with what's available.
You're also getting queries about the gap between the vaccine doses, aren't you? People are a little bit confused about how that works.
Look, absolutely. I think what we are reading from overseas, for example, that the AstraZeneca gets better results if the gap is wider than the 4 weeks. Until now, we are seeking the correct information from our PHN and from the department to when is the best time to give the second jab for the AstraZeneca. While we know it's not before 28 days, but what's the correct interval? I'm not 100% sure yet.
Dr. Clements, is there a difference in between how this is being administered and rolled out in regional and rural communities versus communities in the cities, which particularly have those bigger health facilities that are cities that are holding these travellers returning in quarantine?
Yeah, there is, and part of that's just due to logistics and having enough GPs. Our rural and remote communities are facing GP shortages right now, and we know that about a third of the general practices actually opt out of giving the COVID vaccine. The federal government pitched the rebate for these vaccines at quite low, and that meant that a third of the practices just had to tap out because they just can't afford to bring on the extra staff to be able to roll this out. We're aware that the ADF has even been out there delivering vaccines in some of these rural and remote towns, stepping in when the hospitals or the GPs can't do it.
Dr. Michael Clements, Dr. Hannah Bittar, great to talk to both of you. Thank you. Well, while Australia is days away from commencing the first vaccinations across the general population, one territory in the Northern Hemisphere has already declared mission accomplished for adult vaccinations. Here's our analyst Casey Briggs with a look at the latest figures.
As we approach the end of our first month of vaccinations in Australia, we've administered around about 250,000 of them. And we're starting to see some days now with more than 20,000 jabs being given. It is ramping up, it's just on a very slow incline. There was initially a target that we would see 4 million doses given by the end of this month. Here's what meeting that trajectory would look like since the time vaccinations began. But it's clear now, and it's been clear for a while, that that's just not happening. There just aren't enough doses in the country to enable it.
That of the 3.8 million vaccines we'd contracted from overseas, 700,000 were able to be provided because of the desperately serious situation that we find in Europe.
Overseas, we're now seeing commonly more than 10 million doses being administered a day across the entire world. In Israel, more than half the population is now fully vaccinated. And in the United States, Joe Biden says that his country's recorded 100 million doses, far quicker than the 100 days that he promised they would be delivered coming into office. There's another tiny territory, though, a tiny British territory of less than 7 square kilometres that now says it's vaccinated its entire adult population, at least everyone who wants one, and they've done it in just 2 months. Gibraltar is a dense population, just 30,000 people. Of course, that makes vaccinating the population quite a bit easier. And there's been enthusiasm to do so as well. This is a territory for which international travel is a commonplace everyday event. And as waves have been coming across the world, they have been cooped up for a very long time. Gibraltar managed to deal relatively well through the entire pandemic, right up until January, when waves swept across all of Europe, when they did have a wave of their own. But that should be no more.
British and European regulators have ruled that the AstraZeneca jab is not linked to overall increased risk of blood clots and that its benefits firmly outweigh any potential risks. The review was in response to concerns raised by at least 13 European countries which stopped administering the shot.
Just 25 cases of rare blood clotting disorders among 20 million people to have received the AstraZeneca vaccine. But they were enough for France, Germany and Italy, and a dozen other European states to suspend its use. Now Europe's top drugs regulator has given it the all clear.
Its benefits in protecting people from COVID-19 with the associated risks of death and hospitalisation outweigh the possible risks.
The European Medicines Agency has urged countries to recommence the drug's use.
The vaccine is not associated with an increase in the overall risk of thromboembolic events or blood clots.
The British regulator has come to the same conclusion.
There is no difference that blood clots in veins are occurring more than would be expected in the absence of vaccination for either vaccine.
The centre where I'm getting jabbed is currently using the Oxford AstraZeneca vaccine for those receiving their first dose, and that is the one I'll be having.
It's good news that the AstraZeneca vaccine's been given the green light by the European regulators. And here in Australia, we're relying on the AstraZeneca vaccine.
European investigators did caution a possible association with very rare but serious blood clotting disorders.
PROC has recommended to add a warning to the SMPC and the patient leaflet and a description of these cases.
Whether that's enough to counter scepticism in Europe is yet to be seen. Italy was among the first to announce a resumption of the vaccine on a day of memorial for the more than 100,000 Italians who've died of COVID-19 so far. Linton Besser, ABC News, London.
The situation in Papua New Guinea is going from bad to worse. After escaping the worst of the pandemic for nearly a year, it's now recording staggering rates of infection. Nearly half of all people being tested at the country's largest hospital are returning positive results.
Much-needed supplies have just arrived in PNG from Australia. Tents and equipment to help isolate the most urgent COVID-19 patients.
We don't have enough medical workers to attend to any facility that we open.
Australian health teams will arrive soon. Hospitals are full and at breaking point. Key workers are off sick. 122 staff in the largest hospital have now tested positive for COVID-19, and almost half of the pregnant women tested are infected.
If we do not take serious steps soon, this infection will overwhelm us.
There are also fears that if the outbreak can't be contained, new variants of the virus could emerge.
The escalation of issues with the virus in Papua New Guinea presents very real risks to Australia as well.
The risk is particularly high in Queensland. Islands like Saibai in the Torres Strait are only a short dinghy ride to PNG.
We're rolling out the first range of AstraZeneca vaccines to these communities across the Torres Strait. So very lucky to be in that forward approach and hopefully bring protection to the communities and the people here who live within them.
Australia will donate 8,000 of its COVID-19 vaccine supply to PNG next week and will ask the European Union to release another 1 million doses that it's already ordered.
We've contracted them, we've paid for them, and we want to see those vaccines come here so we can support our nearest neighbour PNG deal with their urgent needs in our region.
Flights between Port Moresby and Cairns have been suspended as concerns about transmission grow, and fly-in, fly-out workers have been stopped from travelling to and from the country.
There are around 1,400 active cases in PNG, but the real figure is likely to be much higher and only going to get worse. An accurate death toll is not known. Authorities say the morgues are full. They believe COVID-19 could be a factor. Natalie Whiting, ABC News, Port Moresby.
And that is the show for this week. Thanks for your company. Goodbye.